I will turn it over to you.
Great. Well, thank you so much, Bridget, for having me here today. It's really wonderful to meet all of you and to take this opportunity to kind of introduce Good Listener and our services. As we were forming the company, we were, kind of met with a couple of different business approaches, and one of them was just underneath the basis of everyone deserves a good listener, and that is personally, professionally, at any age. There's such an overt benefit of having somebody in your life that is a good listener, and if you are lucky enough to have that person, hold on to them and treasure them because they're like gold. And so when we were kind of thinking through what we will do, and what our impact will be in the community, it is to kind of help step in and be that good listener, and help to provide listening services and actionable services as well. So you can, I don't think I have control, but you can switch to the next slide. This is just an overview of our company, and kind of our initial mission statement. We aimed to transform lives through powerful and authentic connection, empathetic listening, and supportive life services that free up capacity and time. And those are two resources that a lot of people don't seem to have enough of, and I am included in that statement. We provide a safe and nurturing space for individuals to feel their emotions and process challenges without judgment or interruption, and have a growing list of supportive services that help to make life easier to navigate. You can go to the next. And maybe I do have access. So we wanted to talk just briefly about our community impact, where we are helping to really benefit those in our community, with supporting emotional support, personal growth, professional growth, and supporting coordinating services going forward, and kind of providing that. This is just a general overview of what we do as a company. Can go to the next slide. Our training, when we were putting together our training and our staff, we really wanted to open up some unique opportunities for college students, and for professionals that are in the industry, to have an opportunity to learn some great skills that aren't necessarily taught to us as professional individuals, but also for people in the healthcare industry. So we have taken several different areas and aspects of training, and provided them into one kind of training course for our Good Listener specialist. So our training includes mental health and wellness professional certifications, certified life coaches, mental health first aid, DEI training, and patient advocacy. We feel that these 5 areas provide unique perspectives, and also the ability to kind of create that well-rounded good listener to be able to fully support our clients. You can go to the next slide. Thank you. So one of the unique differences between the Warmline and what we offer is we are really more focused on mental wellness as a whole, and not just kind of mental health and into kind of that crisis space. There are so many wonderful resources for people that need and would like to access those. So we're kind of taking more of a proactive approach, and really kind of positioning ourselves in the industry, and in our community as preventative support. So we are serving aging communities, professional communities, our student communities, mental health and wellness communities, and health and human services. Our company, unbeknownst to me, the one of the major benefits and kind of working towards different companies that we have a unique experience of collaborating with is part of an EAP program. And so, not just supporting employees, but also their families as well, because eventually we're all going to get to a space where we need some additional support. And so this has been, it's been a unique journey. I was explaining to Bridget earlier, it's what started out as just a good listening service has turned into so much more. And I'm just so excited to bring these services to everybody. You can go to the next slide. So this is just a general overview of our listening services. And we, offer a free discovery call for anybody who would like to call in. And it really helps us kind of just get a sense of what it is you need and how we can meet you where you are. And that's, if you just would like kind of a one-off listening service, and or kind of progression into more life coaching, or access to additional resources, or access to professional services as far as therapy and counseling, and even access into the Warmline. We're just simply there to help guide and facilitate and navigate. So we have three different listening services, sorry. And we offer it's text, phone call, and video call that we can support you on, and or your loved one. I think it's a really good and important piece to note that we're not taking the place of therapy and or counseling services. We are just simply here to listen as you may need, and then help guide you to additional resources or whatever else it is that we can support you on. You can go to the next slide.
And I just wanted to kind of add here, when we were talking with Kerri, we thought this would be a great service for someone who's waiting to see a therapist, because we know there is a long wait sometimes, and this would be a good, intermediate, just somebody to talk to in the meantime.
Yes. So we're introducing the client services lines, and you guys are getting a sneak peek because they haven't even made it to our website yet. So kind of exclusive addition here. But kind of those same lines. What we have found with the people that have called in that need or that are requesting listening services, there's an underlying current of additional a helping hand support, and really just helping to take action to the navigation and the guidance. So we've started to kind of put together some packages for introducing client services. And really, I think this is the space that helps to more so combat the loneliness, to know that somebody's there to check on your loved one, and that we have fully trained staff that understand. We can customize different types of services and different types of language to make sure that it is providing, no pun intended, that peace of mind for you or your loved one to access. So this is, we pride ourselves on diversity, equity, and access. We have such a diverse team, and I am so incredibly thankful and proud of each one of them to be a part of this process. But as I was really, kind of putting the company together, I kept coming back to empathy, and empathy in humanity in action. So this is my quote that I am very proud of this quote. But empathy is our humanity in action, making the world a better place, one compassionate act at a time. And so, empathy is great, but action and compassion is so much more. You can go to the next page. So while we're here and kind of getting through all of that, Bridget asked me to put together, a couple of different things as far as, how to be a good listener. And so really it's listening without interruption, ask open-ended questions, providing feedback, maintain eye contact, and show empathy to be a good listener. You know, part of this, part of being a good listener is also understanding your own bias. And you know, I heard a great quote the other day, and it was, you know, the only you can be kind and generous, um, but you can only meet people where they are, and as far as they've met themselves. And I think that that's such an internal reflection upon self-awareness, and really our own self-awareness, and understanding our own bias, and you know how there may not be an intent of judgment, but you know, really kind of calling into that perspective of you know, understanding your own bias and understanding your own perspective, and really taking that into consideration when you're in the position of being a good listener. And you know, you need somebody to listen to you, and you know, understanding what those signs are, and you know, just recognizing not everybody wants you to solve their problems. They just sometimes need a space that they need to just kind of dump them out onto the table, and you know, and just have somebody be there to help them pick them up. You can go to the next slide. Um, why is listening important? Because listening is the key to understanding, building trust, and strengthening relationships. It shows respect, empathy, and a willingness to learn. Um, you know, part of being a good listener is being inquisitive, but not pushing into, you know, kind of into spaces where the person that you're listening to doesn't want you to go. So it's listening to understand, not listening to respond. And then understanding, you know, kind of the shadow that you cast around that. So, you know, I think listening becomes something that is glazed over in just general communication. And, you know, we don't always listen to understand, we listen to respond. So you can go to the next slide. The benefits of being heard. Active listening can improve relationships, increase productivity, and reduce stress. It shows empathy, building trust, and fostering understanding. So if you haven't caught a theme, listening is, you know, about empathy. It's about building trust and about fostering, about that understanding piece. You know, think back to a time, and this again, this is kind of self-reflection and self-awareness. Think back to a time when you were actually listened to and you actually felt heard, and how empowered you felt when somebody heard you, and you were, you know, essentially speaking the same language and communicating in the same space. And then try to apply that daily to others, and pause and take a step back, and it puts a different perspective on how you interact with people daily. So and go to the next slide. And that's it. Thank you for allowing me to share our services. We are always here to listen, and that's our website. I'm always available, and I'm ready and willing to be a good listener, as well as my team. So thank you.
Thank you, Kerri. That was wonderful, and I'm especially proud of this as, you know, a homegrown sort of organization, and I look forward to seeing, you know, how this develops, um, and how, you know, we can apply these techniques into our lives. So
Thank
I'm
you.
going to turn it. Thanks. I'm going to turn it back over now to Erica Bullock, who takes same idea of active listening with a slightly different approach. If I can get the PowerPoint back up, just 1 second. Not sure why it keeps doing that. All right. I think I heard an interesting statistic about people that call the 988 line, and I think something about somewhere about 80% of crises are resolved just by talking to somebody for about 10 minutes. So that was really kind of one of the big thoughts about around this, is that, just by the act of listening, we can help each other really avoid crisis and, live better lives just on a day-to-day basis. So I will turn it over to you, Erica. Erica, thanks for joining us. Let me start your slides. There we go.
Hello, everyone. Can everyone hear me okay?
Yes.
Okay, thank you. I apologize for being off camera. I'm having technical difficulties, but as long as you can hear me and see my slides, that's all that I ask. So I'm the Warmline manager for Mental Health America of Virginia. We're the state affiliate of the national organization, Mental Health of America. We're also associated with the Mental Health Association of Fauquier County, who is bringing this presentation to you. And I want to thank them for including us in your presentation today.
Thank you.
Next slide, please.
You.
Thank you. So we are a Warmline, a peer-run Warmline. That means that our Warmline is run by peer recovery specialists, people who have lived experience of mental health difficulties, and we focus on mental health. We are a step down from being a crisis line, and we'll talk about that in a little bit. But first, our number is 1-866-400-6248, and our hours are 9 a.m. to 9 p.m. Monday through Friday, weekends and holidays 5 to 9 p.m. We're open 365 days of the year, and we even offer texts on Wednesdays through Saturdays from 5 to 9 p.m. And for those who speak Spanish, we offer Spanish speaking services Wednesdays, Fridays, Saturdays from 5 to 7 p.m. Thank you. Next slide.
I think it's really great that you guys also operate on the holidays, because I know that can be a really hard time for many with dealing with social isolation. So
yes, because this upcoming, well, not just this upcoming holiday season, but the holiday season is a very busy time for us. I couldn't believe how many people are really having a tough time during the holidays. So I'm glad we're open too. And we also are in a partnership with Sarah of Virginia and Richmond Behavioral Health Authority. And we all three of us together run the Alive RVA Addiction Support peer support line. Their number is 1-833-4-PEER-VA or 1-833-473-3782. And they're open 8 a.m. to midnight, 7 days a week. And that line is for people who are having any kind of addiction issues to come up. So that is also a great line. Thank you. Next slide. So what is a Warmline? A Warmline is not a hotline, so we do not handle crisis calls, but you can call us for anything else. We ask that you call 988 if you're experiencing a crisis. And we are a phone line where you can talk about a variety of issues, mental health issues, how your day going. If you need community resources, we get a lot of relationship calls, domestic violence calls. Also, if you're having a good day or have some good news, and if you want to tell it to somebody and you don't know who to talk to, feel free to call us. You can also call us while you're waiting to see your therapist, but however, we don't provide counseling. We're just a listening ear. Our operators are not trained counselors at all, but we are trained peer recovery specialists. So we are here to listen to you. Next slide, please. We are staffed by peer recovery specialists. So our Warmline consists of one Warmline manager, which is me, 2 team leads, 5 on-call support staff who answers the questions of our Warmline operators, which we have 9 of, and they are peer recovery specialist interns who are people who are looking to get their 500 hours during the course of their internship. And since 2022, we've had 30 interns to become certified peer recovery specialists just by being Warmline operators on our line. Thank you. So our Warmline statistics include, we've answered 5,713 calls and texts in 2022. And so far in 2023, we've actually answered 4,086 calls and texts as of yesterday. So these statistics haven't been updated. And out of those statistics, 75% of the contacts have led the callers to creating a self-care plan. And that's just a plan on how they're going to take care of themselves until they can see their therapist, or to kind of de-escalate the situation. And then 99% of our callers rated their experience of being supportive or very supportive or above. Thank you.
And I just have one question. Do you get calls from all over Virginia?
Yes, actually, we get calls from all over the country.
Oh, wow.
But we focus on Virginia, though. We do have a little limited resources, so we kind of limit the people from out of state. But however, we definitely serve the entire state of Virginia.
That's great.
So our peer recovery specialists interns are everyday people with their own lived experience who are well in recovery and have taken a course sponsored by the Virginia Department of Behavioral Health and Developmental Services. It's a 72-hour course, and in order to be an intern, you must have successfully completed the course. And we also train our interns in listening skills, motivational listening skills, and motivational interviewing, how to tell the story, the different aspects of working in the mental health field. And the interns they prepare to take the certification exam that's given by the Virginia Certification Board. Our Warmline operator training includes that the interns earn their 500 experience hours towards certification. It takes about a year to get those 500 hours, and the intern receives hands-on experience providing peer support. They receive check-ins and supervisions on their progress. And we also have team meetings that consist of trainings on the best practices of peer support as well. So they're just getting their feet wet in the peer support field and are getting prepared to become peer supporters, certified peer supporters in a variety of settings across the state of Virginia. Next slide.
And do you also employ the peer support specialists from all over Virginia as well?
We do. We have limited positions to be employed, which means that some of our peer support interns, after completing their internship, some of them have gone on to become on-call support staff people. And matter of fact, I think most of our on-call support staff people and team leads were once interns with us before they got their positions. So those positions don't come up very often, but it's possible. Mm-hmm. And so the benefits of receiving peer support from a peer supporter: the callers can mutually talk with someone with lived experience with mental health and or substance use disorder issues. So you're talking with somebody who's not going to judge you, and they will treat you with dignity and respect, but they have an idea of walking in your shoes. So they have an idea of what you're going through, but we talk with you on a mutual basis, not as a provider, but as a maybe closer to a friend. The callers could talk to someone who's compassionate and understanding. The callers can feel more comfortable sharing parts of their stories than they otherwise would not share with their therapist or support network. And we try to keep everybody anonymous. We do ask a few pieces of your information, like your zip code and the name of your insurance company, but that's and how you heard about us, but that's for statistical reasons only. And we don't put any names with that. Callers can use the conversation to bounce out ideas off of our Warmline operators, but their choices and decisions are ultimately your own. So we don't help you make your decisions, but we can definitely go over like the pros and cons of your decisions, of your choices, and we can just let you know that there are other choices out there, but you make up your own mind. And callers could talk with someone who will share the ups and downs of their own life experiences, so that it's nice to have someone that you can relate to and talk to that's been through some things as well. And then callers can get information on community resources that they may not know about. So we Google information, and we also have a database of different resources that we can give to you. We can also email you resources as well. So do y'all have any questions about peer support or talking with someone who has lived experience? Are there any questions?
I just want to say, I think both services are awesome. I think we are all just so busy with our day-to-day lives. I don't think, active listening requires any special skills. It's just taking the time to actually do it. And, there is actually services that are out there available is wonderful. But I think if we all just actually take these lessons into our own lives and really just pay attention to people and be present, we can really, help each other relieve some of our stresses and, come to an understanding and be more socially connected. So thank you both for sharing. Any other questions or any other stories or?
Yes, I would like to add that the MHAV Warmline is free to everybody in the state of Virginia. We're supported by a statewide grant, and we also have donors as well that support our organization.
That's awesome.
I had a question. Could both of you, and I'm sorry I missed the first part of the process, but could you all share like examples of like who would best call each of the different, the good listener or the state Warmline? Just a couple examples, and then how those resolved or how they were helped.
Okay, I can go. Yeah, so I represent the Mental Health of America Warmline, and anybody can call us. Absolutely anybody. We've had calls from people who have been in domestic violence situations, and we referred them over to resources to help out that situation. We've had people with mental health issues, and we helped them discover coping skills. And we let them know what worked best in our situation. As an example, is how they can recover. We've had people with addictions, and we usually refer those people to a live RVA because they have more resources on addiction than we do. And then finally, we've had callers to just call and thank us for being a listening ear. And we just pass on that information and use it, to help someone else out.
Thank you, Erica. Renee, that was a great question. We have a very similar experience. We get calls from all different communities, community members, including corporate members, and kind of more professional services. So in some specific instances, we have helped facilitate into different areas or different suggestions of support. So, coaching, into counseling, into therapy, and, just kind of being that non-judgmental ear. And then leaning more into the service space, which is where we've started to really track, which is more of that of the helping hand. So helping to facilitate additional services or request, kind of rides, errands, and different needs that can be met by somebody just having the ability to listen, but also kind of understanding what resources are available in the community.
And to piggyback off of what Kerri said, we've had mental health providers like counselors call us, and we provided a listening ear for them because sometimes they don't know where to turn after listening to their patients and things.
Yeah.
And they actually thanked us a whole lot for just listening. We've had other peer supporters call us. People from other Warmlines call us. So just about anybody can call us.
Yeah, that's a great point, Erica. It's supporting the supporters and really just, being there as an overall resource. So yeah.
I have a question. Kerri, in your presentation, you talked about the student community. What age groups are you talking about there, and how do you handle that?
Yeah, so our good listeners are certified, well, a subset of them are certified to help support ages 13 plus. And so right now we're really focusing in a partnership with Morgan's Message to help support student athletes and really kind of launch into that space. Both of my daughters are Morgan's Messenger ambassadors, and so it's a space that really means a lot to me because I have student athletes. And so, we're really working towards, helping to find additional resources and to help train our staff to help support the youth mental health movement.
Okay.
I think another statistic to point out is that social isolation is strong or increased in rural populations, and we know that we have a large aging population, and so I think this is a great service for that group, as well as somewhere that they can lend their skills and expertise as well. Like they could become a good listener and really connect with people through that.
Yeah, and Debbie, to your question, most of our callers at this point have been adults. We've not really done any kind of targeted marketing into the youth space. And I think it's important to recognize that we as parents need additional support and
Yes.
have and have support available for us, because if we're all walking around kind of emotionally unregulated and kind of all
Right.
over the place, the byproduct is our children, right?
Right.
And it's no wonder that our kids are walking around not knowing what resources or what additional services that they can leverage in our school communities,
Right.
and at our homes, because we as parents are just surviving in most cases. So it really, to Erica's point, I think the goal here, fortunately and unfortunately, there's enough to go around, right? Between our two services.
Oh, yes.
And I think anybody, what I have found in kind of coming into this space, because I've spent the last 15 years in corporate America, and burnt out, just I mean, crispy burnt out. And what I have found is that it's lonely, and it's lonely in all the spaces, and part of it is communication. Part of it is it's not a societal norm to be vulnerable and to open up, and I don't know about all of you on your journey, but I know on my journey, personally and professionally, I needed to work to trust my voice and trust the things that I was saying and what I was hearing. And it started with listening to myself and listening to how my body was responding, and how I became more self-reflectant and really started to focus on me as a person, which then I quickly realized that my cup is filled by just being there, and that may throw up trauma red flags for others, and it's because I truly want to help be, and I want to have a staff that in a team that truly wants to help be the person that they want for themselves. And so, it's an interesting process. It's been an interesting journey along the way, but, it's not a competition. I think there's so much more that we can do together as a society, and just putting these resources in people's hands and making them aware.
Absolutely.
You know, it means so much more than a financial gain or anything like that.
Right.
And to piggyback off of what Kerri just said about how it helps the provider or in our case, peer supporters, a lot of our peer supporters, they don't want to leave after the internship is over with, because it helps them so much in their own personal journey and help them in not only professional growth, but personal growth as well. And yeah, so it's a mutual, being a peer support person is mutual relationship. So we learn from our callers just like they learn from us as well.
Yeah. No, and we kind of have a very similar track.
Uh-huh.
We specifically look to employ nursing students, pre-med students, psychology, psychiatry, students that, need that internship space. They need the foundational knowledge of what it means to be a good listener. Being in the medical, field, how many times have you walked into a doctor's office and, no offense to any doctors on here, but how many times have you walked into a doctor's office and kind of, just dumped all the things and, and it would have been super helpful if they were a good listener, right? And if they had that foundational knowledge. So to Erica's point, yeah, I mean, that's exactly the process to which we're really trying to help our staff grow and our team grow. And it all starts with that foundational element of being a good listener. So no pun intended.
Well, we could use it in corporate America too.
Oh, amen.
Yeah. Yeah.
And actually, Mental Health of America, Virginia has a corporate component to it, whereas we have a presentation that we do for companies.
Oh, wonderful.
So we can send somebody out to a company and they can do something, a presentation on mental health in the corporate setting, or good listening in the corporate setting.
Yep.
Oh, that's great.
Yep. That's fantastic.
That's awesome. Any other questions?